Hey, Ron, so talk to us. What's one piece of advice you can give us this Monday morning?
Don't worry about not finding a hygienist or having hygienist issues because I did a no hygienist model very successfully. And I teach that to dentists now on how to do the same thing.
Interesting. Okay, so if you can a little bit expand on how did you first transition to the no hygienist model and what were the biggest operational challenges you faced?
The first 17 years in practice, we built 3 practices. I owned the 3 buildings, staff of 30, 6 associates out of network. Financially, it was fantastic. It was like every dentist's dream, right? And what I realized after that long of managing people, that is not my forte. It drove me nuts. Somebody offered me some stupid money and I took it. And thank God, because it gave me an opportunity to grow up now in being a dentist, to say, what do I really want to do? Why am I here? What excites me? And for me, it was spending more patient time, which a lot of doctors want to do. So I says, if I want to spend more doctor time and I really want to help people with their perio, get them cured basically of perio, get them to look better, the things that excited me and the work I wanted to do, that means that I can't be chair hopping. Forget the chair hopping. I don't know a dentist that likes it. I mean, there are some weirdos that like it, but who the hell wants to keep jumping from chair to chair? This never excited me, never interested me. And not getting paid, they're all joining these cut rate insurances. Why? You went to all this school, spent all this money, and you're an expert. Why are you doing that? I never bought into that and I had a bunch of money. So I didn't really need to worry about the money when I opened up the second practice of a no hygienist model. We figured it out, and very quickly, in today's dollars, we got up to doing $1 million and bringing home half. And I did that for a couple decades. And I had 6 weeks vacation, sometimes a little bit more. Took a month off. A lot of the times, it was the best of all worlds. And so once I retired the second time 5 years ago from clinical dentistry, I started getting on Facebook and just telling dentists, hey, you guys can still have it all. It works out really good. You're having so many hygienist issues. You don't need those anymore. Hygienists are valuable. However, they're getting themselves out of the market. They're pricing themselves out of the market. They have quite an attitude. So many of them think they're doctors. And it's like, no, you're an employee. You might be a colleague, but you're still an employee. So let's not cross that line. This is the weird dynamic. Now, I've met hygienists that are awesome. I'd hire them in a second. Just 5 or 10% of them that I've met. And this is a real problem with most dentists that I talk to. Don't do a hygienist model. Get out of network or minimize the PPOs. Keep just the best ones. You only need 400 active patients for this. That's it. If we all only had 400 active patients, there's plenty of patients to go around. All these dentists are fighting over, I need 1,000, I need 2,000, I need 3,000 patients. It's crazy. No, you don't. Just stop the nonsense already. So that's part of the dance.
Okay. So then when you applied this, or what systems or workflows did you have to adjust to maintain or improve your patient care without a hygienist?
One column, see one patient at a time, minimize the amount of recares that you do. And it's assisted hygiene. No, it would be stupid for a doctor to do hygiene all day long. Get that out of your brain. Oh, I'd rather do something else where I make more money. I could prove to you, any dentist can make $600 to $700 an hour doing a recare visit. I've done this on dozens of practices. How many doctors are making $700 an hour without even breaking a sweat? I mean, that is about the easiest appointment you could do. Why not have some appointments during the day that are easy on us, both emotionally and physically? There's nothing wrong with that. So, if you're doing $600, $700, $800 an hour, if you get a 50% overhead, that's $1 million a year and bringing home $450,000 pace. Why do we need a hygienist? Most dentists, if they made $500,000 a year take home, they would be very, very happy with that. I did that for decades, took 6 weeks off. And it was, dentistry still hard, but I only had 3 cross-trained staff. So when you're doing hygiene, you minimize the amount of recare that you do, and you use a great cross-trained assistant with you. That's all you need to do. And if you hit those half-hour appointments, it's half-hour doctor time, half-hour assistant time on a recare. That time that you spend with them is so much more fun, and it's relaxing in between all the hard work that we have to do. Look, I don't have any physical problems. It didn't burn me out. It was so much easier than what dentists are doing. Please do this. Please look at this.
Gotcha, yeah. What if we have a hygienist, or new patients are coming in, we're a pretty bustling office, right? And then right now our hygienist left. We're listening to this episode and we're thinking, man, I want to do this, but we just have too many patients at this time. What would you recommend in that situation?
That's when you strategically, over 18 months, get out of the network and half the patients will fall off, which is fantastic because the ones that stay will stay, pay, and refer because they like your service. But you got to change the mentality of a PPO doctor to an out-of-network doctor. It's a big change, and you need some coaching on that. If it's not me, get a successful out-of-network doctor to talk to you on how to treat, how to present treatment to patients, how to make the appointments in your schedule. It's way different than a PPO. You can't expect out-of-network patients to get the care that they receive in a PPO setting. It's much different. You got to learn that.
Okay, interesting. So then how have the dentists you've taught responded to the model? Like what are the most common difficulties or misconceptions they have when transitioning?
Number one, it's going to cost me money to do a recare visit because I can make so much more money by going doing blah, 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 blah. And that's their belief. And I say, well, why are you making half the income that I am? And I'm seeing half the patients. I had to teach their belief system. And it's their common belief with dentistry that they miss. The biggest reason they miss that is because where do we make our money in dentistry? Every dentist misses this. It's the diagnostic. The PPO doctor spends 2 minutes diagnosing. Why would you do that when I could spend 30 with the patient? If I spend 30 minutes with the patient and you spend 2, who's going to diagnose more work? Who's going to get more acceptance? Who's going to do bigger cases? Me, all day long. The thing that makes dentists the most income and the most fun is the diagnosing and helping the patient get through that process. They're not doing that. So when you get the hygienist out of that, and the doctor does more of that, it's great. Keep your hygienist. Keep her doing the scalings. Most of the office I see, 16% to 10% of their patients are going through scaling and replating or less, where 50% of the public has periodontal disease. If you don't have at least 30% of your practice going through scaling and replating, there's a lot of bloody prophies being done. It's just a fact. Now, your 2-minute exams, I'll fly anywhere in the country. I'll follow you around, doctor, after you do the exam, and I'll find $5,000 to $50,000 worth of treatment every week that you didn't even diagnose or talk to the patient about. So don't give me that bullshit. 37 years, I can't be bullshitted. There isn't nothing you're going to tell me that I haven't seen in dentistry in 37 years. I challenge any doctor at that one. I've done this already.
Yeah. Okay. So then how has the dynamic when this happened within your team changed the removal of a hygienist? Like, did you need to train your dental assistants differently? And how does this affect the efficiency?
Yeah. I mean, you have to spend time with the hygienist, which was a lot of fun, teaching them dentistry. My assistants knew almost as much as I did. And technically with their hands, geez, I had 2 assistants. They were better with their hands than mine. You should see their temporaries. Their temporaries were awesome. They were very good with their hands. So you might be surprised that one of your team members might be just as good, if not better than you. And they're quick. They come up with ways to make things more efficient. So you just spend time with them, nurture them. And there are a lot of smart people that really appreciate that, can really help you. But yeah, you have to train them and be patient. You know, it's like a child. You know, if you're at home, what are you going to do? Scream at them all day? You got to be very patient.
Yeah. No, that makes a lot of sense. So then did you communicate the change to your patients, or like, did you face any resistance? And if so, how did you overcome that?
At first I did. There was always remarks, and dentists, this is one of the things, the challenges they have, is the patients will mention something about the hygienist. And most dentists look like, oh, you're doing so bad that you can't even get the hygienist. I flipped that around. I said, look, I spent 8 years in school. Would you rather have somebody clean your teeth that's been to school for 8 years, or somebody that's been to school for 2 years for the same money? And I just shut up. Every patient then laughed and says, of course, 8 years. I go, good. Then you win me today. All right, let's go. And that was the end of it. You built more of a concierge service and a better service. It's like, holy cow. No doctor in this community spends this kind of time with their patients. That's what made us unique. And those are the kind of patients that you're willing to attract, that are willing to pay your fees. Most of my patients were not rich. They were middle-class America, but they were looking for better service. And they found the money or payment plans in doing a treatment in stages.
I like that. So then is there any fear, Ron, where it's, oh man, I don't ever have time off, almost a thing, right? Like I'm going to be called for emergencies, for any little thing, for cleanings, all these stuff. It's too much on me. I want to start delegating these things that I kind of don't like. like prophies and stuff like that. Where does that mentality go?
Okay, the mentality is, doctor, do you like to make money? Well, of course. Well, then you better find a way on how to do a recare and do part of the prophy. You're not doing the full prophy. You're doing part of it. So my sonic cleaner, I thought of it as a perioprobe. It just wiggles up and down because I go through every pocket and look at every tooth and take pictures along the way. To me, it was a diagnostic tool. So doctors, it's how you look at things. I looked at it as this is giving me an opportunity to find the work that I want to do. All of a sudden, I'm doing cases I want to do. So it's the bad attitude that they have, the belief that they have. You got to make lemonade out of it. It was great. I had lemonade all day long like this. I was in such a saturated market in Chicago that there was like 15 doctors within walking distance. I was always busy. I made more income. I took more time off. And they all were doing the opposite of what I was. And when I told them about it, they go, oh, no, that'll never work. Okay, just keep doing what you're doing because I'll just clean up here.
Yeah.
It works. It works every time. You just have to change your belief system. And I'll prove it to them. I've been doing this for so long.
Yeah. No, that's wonderful. Now, real quick, one of the last questions. Is this model, because you mentioned where you were at in the location, is it scalable for practices in different settings like urban, rural, large, or small? What adjustments would need to be made?
It's easier to do in the rural area because if you're the only one there, if you give better service than any dentist within 30 miles, 40 miles around, holy cow, they immediately drop all the insurance. They can't believe it. I can give you a bunch of names of a bunch of doctors that haven't to. In the urban areas where there's a lot of competition, New York City, Chicago, big cities that are wealthier, this is perfect because you don't need a lot of patients. There's patients that want good service in urban areas, period. You don't need a lot of them because it's so condensed. It's not that difficult to find 400 patients. You got to get a really good marketer, but you got to learn how they answer their phone. The doctor has to present treatment and treat people well. You have to learn those leadership skills and those presentation skills too.
Awesome, Ron. Thank you so much for this. I appreciate your time. And if anyone has further questions, you can definitely find them on the Dental Marketer Society Facebook group, or where can they reach out to you directly?
Okay, DRS Coaching Systems Facebook page. Just go there. You'll hear what a bunch of doctors are saying about the coaching. And go to make an appointment with me at pharmaden.net. That's PHARMADEN.net. At my calendar. That's my nutraceutical company. We figured out at Loma Linda, we did a double-blind test and figured out the periodontal disease. If you give them a certain nutraceutical during treatment, the outcomes are much better. The bleeding pocket depth was much better. We created that 20 years ago, used that on so many patients. Go there, go to the website, go to the calendar, make an appointment. I'll talk to anybody for free. I'm not an expert. I'm just going to tell you what worked in our office, what worked really well, and what we achieve, most dentists are trying to achieve. So I'm not saying I'm some guru. I'm just going to tell you what worked for me. And I'd be happy to show you exactly the same way. I got no special skills. If I can do it, you guys could do it.
Nice. Awesome. So that information is going to be in the show notes below. And Ron, thank you so much for being with me on this Monday morning episode.
Thank you very much for inviting me.